My bio said, I've been doing this since 2014. It feels like a long time. And doing this for 10 years, you learn some things. You learn about the power of collaboration. And I'm so fortunate to serve with some really remarkable leaders who have really invested in our community long before they were elected. And I want to acknowledge and welcome Councilmember John Overton, who's joining us today, Councilmember Ann Little Roberts, who's also a member of the MADC, who's joining us today. I think it's important that we have civic leaders that continue to take an active role, not just in talking about the crime and the challenges that exist in our community, but to offer hope for the future. And I'm very, very lucky to serve alongside them. Also, I think it's important to point out Mayor Tammy is here as well up here in the front. Good morning, Mayor Tammy. It's always nice to have you here. I think the MADC was a vision of Mayor Tammy's, and she's obviously attended every one of these. I've only been attending, I think, since 2009. So you're the OG, and it's great to be having you here this morning. The other thing that I've learned is the power that one person can make when it comes to making a difference. People like Mayor Tammy who have made a difference in our community. People like each one of you that gave up something else this morning to be here, to celebrate and to take a moment and reflect. Recovery is so much more than one person. I know that's what really resonates with me. It's because recovery is really for everyone. It's for all of us. What makes Meridian great is our dedication as residents, people, and community advocates. Our community celebrates gains made by those in recovery together through amazing events like this. This increases awareness and gives a greater understanding about substance abuse disorder and overall mental health. I just want to take another quick moment and thank the MADC board and Kendall for continuing to host this event. I think it's an important event for our community. Now, enough of me, because you didn't come here to hear me jibber jabber. It's my pleasure to introduce Benjamin Seymour. Benjamin is president of the Southworth Associates, easy for me to say, which oversees the state of Idaho's Health Professional Recovery Program, as well as Idaho State Bar's Lawyer Assistance Program. With over 24 years of experience, Ben will share his experience as a person in long-term recovery and the importance of access to treatment.
Thanks for the introduction, and thanks, Kendall. I want to thank the City of Meridian for asking me to speak today. It's always an honor for me to talk about recovery. I've been doing this work for a long time. And I started in the addiction treatment field in 1999. And any chance I get to talk about recovery, it's always an honor because it's something that has so much meaning to me and the people in my life. And so, I currently run Southworth Associates. I took over from my predecessor, John Southworth, who was a legend in Idaho when it came to helping addicts and alcoholics and people with mental health disorders. And so I'm honored to continue that mission. And I work with professionals, compared professionals. So we work with, it's the program called HPRP. We recently condensed all the programs under one umbrella under Governor Little's orders, and he wanted everything to be under one contract and one umbrella. And so I work closely with the Department of Professional Licensing. And so if we have a physician, pharmacist, dentist, anyone with a health license, basically that has a problem with drugs or alcohol, what we do is obviously we want to protect public safety, but we also want to make sure that those individuals get the help that they need and are able to continue helping our community through their skills. And so so that's a big part of what we do, and I'm going to come back to that in a little bit. But really today, the biggest part of why I'm here, and what time do you want me to stop? I just want to keep that. I can talk
till 8:50.
8:50. Okay. I want to give you guys an hour here. So basically, the reason a big part. This talk's a little different for me. Usually, I'm wearing one hat or the other. So I obviously do a lot of talks for professionals and educating about addiction. I'm an adjunct professor over at osteopathic college down here and do a lot of other speaking. But today I also get to wear the other hat, which is I'm a person in long-term recovery myself. And so I think that's, this talk, I'm going to do my best to kind of intertwine the two and provide useful information today. But, my story started, I came from a good Scottish family. I held out drinking as long as I could. I didn't start until I was 10 years old. And I got into my dad's liquor cabinet. And, what happened to me was something that I had no preparation for. And the second that alcohol hit my brain, you know, I had a different reaction, I'm told, than other people. And I said, I want to feel like this for the rest of my life. And what happened was that I got an exacerbated relief from that alcohol, you know. And so while the people around me were not having that reaction, you know, and the story I always use to kind of differentiate the difference between someone with a substance use disorder and a normal person is, you know, I could take two kids, take them to a keg party, have them drink the same amounts, and interview them the next day. And, you know, the kid who does not have the genetic predisposition for addiction is going to say, you know, it was fun when it was going on, but today I wake up, I feel terrible, I was throwing up. And you could ask that kid, are you ever going to do this again? They'll say, I don't know. I mean, I'm not trying to do it soon. You know, that's for sure. I feel terrible now. Whereas if I interview the kid from with the substance use disorder, they're going to say, it was amazing. You know, all of a sudden I felt comfortable in my own skin. I could talk to people. All this anxiety and fear went away. And well, would you ever want to do that again? Absolutely. And genetically, what we know, and from a neurological standpoint, is those kids have different survival salience tag that experience in their brain and have a totally different medical reaction to alcohol. And so I was one of those kids, you know. And so for me, I then dedicated, you know, as much time as I could. I was predisposed and preoccupied with feeling that way, and totally preoccupied with when was I going to get to drink again, when was I going to get to feel that way again. And for me, it was a medication of sorts. And so, you know, my disease progressed really rapidly. You know, I began using drugs and experimenting, and by the age of 15, I was a IV heroin user. You know, and I came from an upper middle class family, a good home, raised in the church, very successful parents. My mother is a doctor of theology, so talk about shame. Like, you know, I had all kinds of special shame going on at home. But I was raised to believe addiction was a choice. And so that really created this inner conflict within me of why is it every day I wake up, I don't want to do this, and I'm repeating this behavior, and I'm hurting the people around me, and I know I'm destroying people's lives, and I don't want to do this anymore, yet I cannot stop. And I remember waking up every day saying, I don't want to do this today, yet by, you know, 10, 11 a.m., there I was doing the footwork to continue my drug use. And, you know, at 14, I got shipped off to boarding school, and I really, I did well there. They drug tested us, and I did very well. But then I got back, and my family said, do you want to go back to boarding school or come home? And I chose to come home. And immediately, you know, it's just like that addiction didn't go anywhere. You know, it was left untreated. It was dormant for a year while I was in an institution of sorts and being monitored. But it was just sitting there waiting for me. And the second I got the access again, it was off to the races, and I progressed rapidly once again. And you know, and I think that's really the genetic component when we look at the illness of this, is that we can take people who are in prison and separate them from addiction for years and years and years, and then wonder how they could go back when they get out. And, you know, recovery, as we talk about what recovery is, it makes sense that recovery needs to encompass the whole person, you know, and it really needs to treat all the different aspects of their life, you know. And so when we look at the difference between abstinence and recovery, those are two very different things as we have this conversation. And, you know, abstaining from drugs is one thing, but really treating the individual and helping them get new skills and educating them about what addiction is really what the work that I'm dedicated to, and that so many in this room are dedicated to. And so I started trying to get help at about 16, and you know, all my life, you know, and I think about my poor mom, you know, it's like she was getting me in front of therapists. Everybody had an opinion on what was wrong with Ben, you know, and that opinion and the treatment was, for lack of a better term, looked different depending who you asked. You know, the church felt I needed to pray harder and believe harder, and, you know, change my behavior, and my mom felt I needed to change my social group. She didn't like my girlfriend, you know, things like that. The therapist gave me some books to read, and you know, and then, you know, I got in some trouble, got DUIs and things like that, and their prescription was, you know, you need a little bit of jail, and then you need some court-mandated classes, which actually was, you know, helpful. And but all that to say that, you know, eventually I started ending up in treatment centers. I ended up at Menninger, which, if anyone knows what Menninger is, it was like one flew over the cuckoo's nest. It was in Topeka, Kansas, and I ended up there when I was about 17, 18, and I did my first neuropsych eval. That's a very in-depth battery of tests. And by the time I was done with that, the doctor looked at me after 2 days of testing and said, you know, you remind me of a PTSD ward veteran. And he said, the things you've survived and been through, he says, it makes absolute sense why you need to meditate. You know? And that didn't really help me. Then it just gave me another excuse to go off to the races. I was like, oh yeah, all right, great. Now I have a reason, you know. So and that's the logic for me. But basically, you know, what happened was I kept ending up in these places. And then I was in a facility once in San Diego, and they said, do you want to go to a meeting, a 12-step meeting? And I said, not really. And they said, well, if you go to the meeting, you can smoke cigarettes. And I said, I'll go to your meeting. And so so they took me out to this courtyard, and we did this meeting. But what happened was that I saw that there were people who had the experiences I had, felt the way I felt, and all of a sudden, that missing piece of the puzzle came together. And I realized, it's not that I lack morals. It's not that I, you know, plug in whatever theory you have. It's that I have this thing called alcoholism and addiction. And what does that mean, you know? And so I saw that these people were happy, living fulfilled lives, had long-term recovery, and it didn't make sense in my brain how they could be abstaining, not using, and feel that happy. Because for me, you know, when I was not under the influence, life was unbearable. You know, I was always very self-critical. It's like I had this highlight reel of everything I ever said wrong, did wrong, constant shame, self-judgment, self-condemnation. And the only thing that turned that off was using. And so, but I saw these people who were saying they were free of that, and you know, I didn't get it right away. I would love to tell you I did, but I went in and out for a little while. But what happened was that I got to this place where you know, I couldn't imagine continuing the way I was living, and I couldn't imagine continuing without drugs. And so I was at this crossroads of, I'm going to give this thing one more shot, or I'm going to kill myself. And you know, I was 19 years old. It was the morning of October 15th, 1998, and I had been back at my mom's house. And my mom, she got educated. You know, she started doing Al-Anon. She learned about addiction, and she set boundaries with me. And I was out on the streets when I was about 17, 18 for a period of time, and I came back, and I'll never forget, I asked her, you know, could I have $5 for a pack of cigarettes? And she said no, because when they find you dead, I don't want to wonder if the 5 I gave you is the 5 that killed you. And I said, wow. And she closed the door in my face. And you know, that was a real pivotal moment in my life. She was my number one enabler, you know. And so I kicked around a little longer, and I ended up back on her couch, you know, fighting to get sober, and I ended up in a facility in Palm Springs, California, which was the last house on the block. You know, they were known for taking the guys who had failed out at every other treatment center. It was men only. And what those people did was, you know, I had the education, I had the knowledge, but I didn't know how to integrate it into my life. And those people taught me how to integrate recovery into my life and really live what recovery is all about. And, you know, I would always go into these facilities, and they would ask me this question that I hated. They say, what are you going to do different this time? Because they would look at my record, they would get all my medical records, and they would say, I mean, you've been everywhere. We don't know what to do with you. And I would always have this great answer. This time I'm going to do this, or I'm not going to use this drug, or I'm going to do this. And I was always trying to control and figure out what the answer was. And this time when I walked in, I was defeated, and I just said, I don't know. I don't know what I'm going to do. And for me, that was a true surrender. You know, to become teachable, to become willing to follow the direction and do the things that I needed to do to really treat this disease. And so over the course of the next 4 months, I did that. I stayed close to people in recovery, and I lived in, you know, meetings, doing the things I needed to do. And so, you know, as a result of that, I started to, my life started to change. You know, and I think that, you know, today I deal with so many young people, and you know, it's a different world out there today. You know, the risk is a lot higher, and that's coming from a heroin addict to say, you know, it's really risky out there. If I was out there today, I don't know if I'd be alive. You know, with fentanyl and the things that are going on out there, it's changed a lot, and it's a very real life and death situation now, and the consequences come a lot faster and a lot harder these days. And so, you know, and when I think about what it takes for someone to actually get clean and sober and get into recovery, it's like threading a needle. You know, getting somebody into that state of where they're willing and able to take the help without dying, because it's a real fine line, right? You have to be in enough pain to do whatever it takes to get recovery, but you also have to live through that. And, and so it's just, I continuously become more grateful for this gift of recovery and getting to do what I do. And so all that to say that I stuck around. I went to school to be a counselor, and I started my work in the field, after I got sober. And so, I started out as a counselor, and then became an interventionist, and started flying around the country doing interventions. How many of you guys have seen the show Intervention? Anybody? Yeah. So it used to be, I started before that show, right? So it used to be I'd walk in to do an intervention, and people say, "What's going on? I don't know what's happening." And you'd say, "Sit down," and next thing you know, everyone was crying, and we were taking them off to treatment. Now, when I do an intervention, they walk in and see I know what this is. I've seen the TV show, and it's harder to do nowadays. And so anyway, doing interventions is, I really get to be reminded of the pain that addiction causes in families. And a friend of mine, Mark Lundholm, who's a comedian, he flies around. He always says first thought wrong, but he says, addiction is the only disease that can kill people that don't have it. And when somebody gets drunk and drives into a family or something like that, this disease affects a lot of people. And so it's really important, and I really commend the City of Meridian for the work that they've done, and the Mayor's Anti-Drug Coalition. Thank you, Mayor Tammy. And I started a business in Meridian in 2009 called Ashwood Recovery, and it was up over off Millennium near the high school up there, and it was a little, we had 1,500 square feet, and I came to the state and I said, I'm going to open a treatment center, and there were no private treatment centers in the state of Idaho at that time. A lot of the programs were were funded through the state, and so DOC and different agencies doled out the money, and the programs were basically primarily for people on probation, parole, and Medicaid and things like that. And I said, I'm going to open a private treatment center. And the state said, well, we don't understand how you're going to make any money doing that. And I said, insurance, we'll figure it out. And sure enough, that grew and blossomed. And then we eventually started North Point Recovery, which now has a huge, beautiful facility in Meridian. And, it's been a real honor to see recovery happen here, and to have a day that celebrates recovery is it's something that it touches all of us. The opiate epidemic was a nightmare. The amount of people that have died and the loss, it's terrible. We were basically losing an airliner of people every day. And the one piece that has come out of that, though, that I do believe is a positive, if we can put any positive on it, is the stigma is starting to be eradicated. Because now there's nobody that hasn't been impacted. Everybody knows somebody or has a family member that's been touched by this disease. And so for that, I think that days like this and events like this, it's really about learning how can we better show up for those people. And in my career, I've been fortunate enough to work in a lot of different settings, and the things that I really see today that are happening are community-based treatment. Having cities and legislators that understand the value of recovery and how important this is, because it costs taxpayers tons of money, with the wreckage and destruction that happens with addiction. And so us getting ahead of it, being proactive, offering services, education is huge, and I raised 2 kids in this city, and having both parents that had the gene of addiction, the talk we had with our kids was, listen, genetically, you guys have a predisposition, and we don't know if you have the disease or not for sure, but chances are if you go out and you start experimenting and doing the deal with drugs, which is part of growing up for a lot of people, that's just the reality of it, you may not be able to stop. And I think arming our kids with that information, if we have the disease in our family and genetic predisposition, it's really important for us to arm our kids with that knowledge, because when they go out and they experiment, and we see it so often now, that they may not even be experimenting, and this is the other piece of the opioid epidemic that was so heartbreaking was, we see these kids who are, collegiate athletes and on the course for huge successes, get injured, and all of a sudden, you know, they're strung out on pain meds, and next thing you know, they're buying drugs on the street, you know. And early in my career, I did a lot of work with the LAPD, and so we worked with officers who had issues, and it's really eye-opening when you say, you know, here are these guys who are very law-abiding, would never break the law, very black and white in their beliefs, and have strong moral code, and then they're caught on the street buying heroin. How does that happen? Well, I'll tell you how it happens. You know, you have a genetic predisposition, and there's a trifecta that needs to be present for addiction. There's the genetic piece, but then there's also a chronic severe stress that needs to kind of happen. And then there's exposure. And when we get those three things to line up, it's about a 90% chance that addiction is going to take root with that kind of soil in place. And so I would see these guys who were, you know, on the job getting injured in really bad situations that were traumatic. They go to the doctor says, here's these pain meds. Well, these meds are 10 times stronger than heroin. And these guys are taking these meds, and then all of a sudden, you know, it gets away from them because they're under chronic severe stress, and they've now been exposed to this highly powerful substance. And they have some trauma that's going on because of the work. And so, you know, I think that, you know, there's just so much change that has happened in the last 24 years since I started. You know, like I said early on, I walked in the homes all the time with physicians, you know, people who hold a lot of power in society, and they did not understand addiction. You know, even in med school, you know, most of my friends who are doctors, I say, how much education about addiction did you get? And they're like, maybe an hour? None. That's changing. You know, ICOM has me come in and talk to the kids there about addiction. I was just at ISU in Pocatello doing the third year med residents. We were running through case studies with them about addiction and educating them about the risks in their careers and exposure. And you know, when we get into licensed healthcare professionals, it's also a high stress career. There's a lot of trauma, and then there's a lot of exposure to substances. And so that is why we see a high rate of addiction amongst healthcare professionals. And to give you an idea of what that looks like is the general public is 1 in 10. So 10% of the general public has a SUD, substance use disorder. When we get into healthcare professionals and attorneys, we're looking at 15% up. So, you know, that's a huge increase of addiction amongst that population. Also, suicide is a huge part of that. And so, you know, really when, you know, in the work we do with healthcare professionals, it's important for us to understand that they're human, you know, and so often they're held to this higher standard of they should know better, and there's still a lot of stigma for us to work on, you know, and I think that this is the way this disease works is that it uses our own intelligence against us. And so I've never met people typically that are too dumb to get recovery, you know what I mean? Because getting recovery is a very simple process. But I have met people that are too smart. And what I mean by that is their own intelligence keeps them from being humble enough to accept the help that they need. You know, things like physician heal thyself, you know, are these misconceptions that a lot of times drive these guys to live in secrecy. And what we know through studies is that the more punitive we are about addiction, the further underground it goes, right? So the more punitive of an approach we take with addiction, the more people hide it until the wheels come off and some kind of crisis happens. And at that point, they've hurt a lot of people typically. And so now we know that when we create these safe harbors and these proactive ways to say, hey, I have a problem, I want to protect my license, I'm coming into your program, we can protect their license, get them off, get the help they need, and then monitor them with forensic accountability for 5 years. And our outcomes data is typically over 70% with healthcare professionals, you know. And that's huge when we look at the general population of recovery is like 10% if we're lucky, you know. And so, but that is getting better. And so what's happening now is treatment providers are understanding we need that post-treatment accountability. Because going away for 28 days is a great start, doing some outpatient is great, but what happens after that? And so really utilizing community-based 12-step groups, drug testing, family support. There's all kinds of different resources out there now that are becoming available and that are free and affordable and things that we can do to support the community and people who are trying to recover. You know, Meridian, I know Kendall and I've talked about in Boise as well, you know, now have clinicians that go something I really want to commend you guys on. That's a huge, that's going to save a lot of lives, because so often, and I'm guilty of, as a person when I was in active addiction, I exhibited really poor behavior, and people with severe mental illness can exhibit really poor erratic behavior. And so I understand the pressures that puts on law enforcement. And so I think really involving clinicians and getting them out there is a huge win for the community. I also am very excited about the mobile crisis growth that's happening in our state. A friend of mine, Jaime Garza, has recently taken over the mobile crisis and expanding those services into more rural parts of Idaho, and 988 and all these services. Suicide is another part that, we can't talk about addiction and mental health without talking about suicide, because it's impacted so many people now. And the thing I really want to hit on, one of the things they asked me to talk about today is kind of drug trends, what we're seeing in the community, and then things we can do better. And I think it's important to understand that in this post-COVID, and I hate to even bring COVID up because I know we're all tired of hearing about it, but when we talk about physician health, that also applies for the general population. And every year I meet at a national level with the Federation of State Physicians Health Programs. So every state in the country has a program like ours. Idaho's program is one of the best programs in the country, and I'm really proud of that. But every year we get together, we talk about the trends we're seeing and what to expect. And post-COVID, we're expecting the fallout from COVID is going to last 10 years. We're just seeing the tip of the iceberg. The depression, suicidality, isolation, all these maladaptive coping skills that people have fallen into as a result of that isolation. And a psychiatrist who works for us, Dr. Broadhead, a very sharp guy, said neurologically what we're doing when we're staring at screens all day, and in COVID that's all we can do. All our meetings were on Zoom, we're staring at screens all day. That does some neuro rewiring that triggers dopamine. And so when we try to taper off all that screen time, we're going to have this huge deficiency, and there's going to be a lot of depression amongst the general population who's been on the screen all day. And that's just medical, right? And so a lot of this depression that we're seeing is happening as a result of that. And so we're seeing the cases in the old days when I was doing interventions, it would be drug addict, alcoholic, something going on with those. Now these cases are a lot more acute, and it's not just me. This is a national trend that we're seeing. A lot more intertwined mental health, depression, and actually we're seeing a lot of psychosis that goes along with this. So we're seeing all this fallout that's now happening as a result of this. The other thing that we're seeing is a huge amount of psychosis related to marijuana use. When I first saw this in about the early 2000s, we saw a really potent strain of marijuana out of California, and we started to see these really wealthy kids from Newport Beach getting psychotic, and it was because of these really powerful strains of cannabis, and this was before it got as powerful as now. But what we're seeing now is that through all the genetic mutations of marijuana, is we're seeing this huge outbreak of psychosis amongst young people. And so when we talk about schizophrenia, or psychotic disorders, everybody has the genes to have one of those diseases in their body. It just lays dormant for the majority of America, or the majority of people. And so when we look at all the schizophrenia we're now seeing, it's because of this super potent marijuana. And it actually has the power to trigger that gene. And so we're seeing these kids come in who were, thought they were just experimenting with weed, edibles, whatever it was. And now we're seeing these psychotic features with them. And it's taken a long time to get them stabilized and integrate back into their families and into school and all the things. And so, now more than ever, I think this work, having community-based resources that educate kids about, and not scare tactics. I think that we know, a lot of the scare tactics don't necessarily work. I think we need to have these honest conversations of, look, you're probably going to experiment. You're probably going to be presented with the option to drink alcohol, use drugs, whatever that looks like. We just want you to have the information and make informed decisions. Because as we know, the more we tell kids, raising two kids, they're in their 20s now, but it's like when I had teenagers, the more I told them not to do something, it was just like a guarantee they were going to do it within 5 minutes. So anyway, so as we look at going forward and all the things that the city can do, I think you're on the right track. Another thing that happens here that's been really fruitful is that there are evaluations that happen in the high schools here in Meridian, and there are evaluators if a kid gets caught with drugs and things happen in the high school that they will dispatch assessor to go out to the school and assess that kid, and then report the results to the school to see if there's things they can do. And I did a lot of those evaluations for a couple of years. Steve Filer and some other people that were in the school district back then. I'm not sure who's heading that up now, but that's another service that Meridian does that I think is very fruitful and helpful. So that's kind of what my take is on the city. But as it comes to recovery, today what I know about recovery is that it takes, I hate to put it takes a village, but it does. Recovery is not something I can do on my own. When I look back in my life at all the people that I think are angels now, it's like that said a thing or did a thing that ended up in me ending up where I did to get the gifts that I've gotten in recovery is huge. Like I said, I got clean and sober at 19, went on to start businesses, raised a family, and went through it with one of my own kids. And I had a daughter who was out of control for a while. And when it's your own kid, even knowing what I know working in the field, and I'll tell this story about it. She was in college, and I got a call from her apartment complex. And the deal was, if she went to college, we would pay all her expenses as long as she was a full-time student and pulling good grades. And I got a call from the apartment. They said, your daughter hasn't paid the rent in 3 months. I said, well, I looked at my dead wife and said, well, I gave her the money to pay the rent. What's going on? She looked at me. She goes, really? I said, I'm that guy right now. She goes, you're the guy. That denial when it comes to our own kids and our own family is huge. And so I think that, reaching out to, there's a resource table back there and getting help, bouncing it off other people. I have people in my life today that I trust and I bounce those things off. And if I don't have the answers, I'm gonna come to them and say, what do you think about this? But, we do have those resources now, I know, and I'm really happy for all the resources that we have. I'm really glad to see representatives from North Point here today. North Point does great work in our community, and I'm really proud of the mission. I'm not involved in operations in North Point anymore, but they're growing across the country and really into underserved communities. And I'm proud of the work they're doing. Really grateful you guys are here. And then we've got obviously Southworth Associates, who I work with, and we do interventions in the community. And so we'll come in if a family is in crisis and says, I don't know what to do with my kid, my husband, my wife, whoever it is. We'll come into the home and we'll actually help the family stage an intervention and get that person to treatment. And it's a very powerful process. And I think that if you have someone, the 2 cents that I would give you, is if you have someone in your life who you think may have a problem, it's better to have the hard talk than wonder if you could have done something. So, keep that in mind. If you don't know what to say or how to have that hard talk, call us, talk to an addiction professional in the community, reach out to somebody who can tell you how to have that conversation. Because that conversation saves lives. And a lot of people, I can tell you from the mind of an addict, it's my family didn't know I had an addiction problem until I walked into my parents' room and said, I'm a heroin addict. They didn't know. I hid it so well. And and I asked for help. Every time I went to treatment, I went because I wanted to go. So this is a thing where, we need as many hands reaching out saying, come with me. There's a better way. There's resources. It's one of the hardest things anybody can ever do. And I've flown across the country and worked with all kinds of people that you never think would have this problem. And there's still so much shame associated with it. For people to say, yes, I'm clergy, yes, I'm a doctor, yes, I'm a law enforcement officer, yes, I'm whoever, and I have this problem. And and I think the more we can talk about it and destigmatize it, get out here and say, yes, I'm a person in long-term recovery, the better. The old saying, once an addict, always an addict. On some level, that's true. There are things I need to do to manage my recovery on a regular basis, but I don't behave the way I used to behave. And today I have a really full life, and the gifts I've been given, are accountable. I can't say enough about it. So what I wanted to do is leave a couple minutes. Am I allowed to do questions? Is that cool? Okay. I want to leave a few minutes for questions at the end. I'm usually really bad about that, so I wanted to make sure I do that. So
I go back to that, your family had resources and belief in you.
Mhm.
So they spent a fair amount of money
Yep.
trying to help you, which is, wonderful. Oh, what would your odds been if you didn't have their support back in that day? And is it better now than it is for those people that don't have the family resources, or they may have the love, they may not have the money resource to send around? Is there
Yeah.
programs better for 14 to 19-year-olds
Great
now
question.
than there was then, or?
Great question, yeah. And I think that, obviously having resources, the engagement of my family was a huge
Sure.
asset. But there were times where I had to access community-based resources because they had cut me off. And so I learned a lot in the community-based, shelter-based programs that I went through as well. And so I'm a firm believer you're going to get it regardless of setting, right? I think that setting helps, and there are things we can do, amenities and things to make it better. But I think that there are a lot of free community-based resources, and when I look at what really saved my life, it was a free community-based resource.
Wonderful. I didn't get that from the story.
And there's some anonymity that goes with that in
Sure.
12-step-based recovery
Yeah.
that I try not to cross
Yeah.
the line with that. But there are free 12-step-based communities across the country, and we have a huge base of that here
Oh,
in the Treasure
wonderful.
Valley. And so I encourage look at 12-step-based recovery as such an asset. And but back to 14 to 19 in that kind of age range, there are also more community-based programs here now for adolescents. That and there is state funding available, so the state has gotten really good about trying to make those funds more accessible, easier to get. Department of Health and Welfare has those resources. So if you call DHW and say this is what's going on, typically they're gonna. It's not immediate. There are some hoops you have to jump through to access those funds, but you can do that. And then we look at more state. The healthcare plans that are out there now, most of them will cover some kind of treatment, and it depends on policies that have carved out. So it's a tricky thing, but yeah, there are healthcare benefits now for addiction, which has made a lot of progress since I first started.
We're talking about the 70% success rate within professional people in addiction. It's hard to ask the question, but do you think that's part of them having some kind of structure and purpose, being professionals? And then how do we make that a reality for underprivileged, underserviced population, right? Because to me, that's the scary part for me in recovery, right?
Yeah.
Was who am I going to be without those substances? That's all I know,
Yeah.
right?
Yeah.
And so how do we as a community give people that have never really had purpose so that they can find a way and see that light, right?
Yeah.
And I don't know if that's a question, but I'd love to pose it for everybody in the room. How do we start doing that? How do we give structure, purpose to these?
And that, it's valid, right? The reason we see the success rate with the physicians is like, fish in a barrel. If they have a license on the line, there's a lot of carrot and a lot of stick. So we know that is a huge determining factor. So it's now about reverse engineering. How do we create that, exactly like you said, for the people who don't have a license on the line? And what we have found the biggest engagement we can use, the leverage we can use, is family support. And so the more we engage the family around them to put that family support, if they have family, the better. If they don't have family, then we look for who are the key people in this person's life. Let's bring them into the process and get them engaged, because those are the people in that person's life they don't want to let down. Probably the people they hurt the most. Probably the people who are most concerned about them and have the most investment in this individual. So we really need to leverage those relationships.
Right.
And so I know for us, we also do private monitoring, right? So with the physicians and pharmacists and all those guys, the lawyers, our testing will hold up in a court a lot, right? Because of public safety, so we're doing hair tests, nail tests, all that kind of stuff. But with people who don't have a license on the line in other populations, what we can do is create that testing protocol and have releases signed to tell the family if they relapse. And what that does is create transparency, because secrets and this shadow of secrecy is what really, where addiction grows, it's where it thrives. And so the more we can be transparent, less punitive, and say, look, we know you've got this thing, you need help, let's get the family buy-in, right? And that's why family programs and treatment are so important. And things like drug court, veterans court, all those programs are really successful because of that accountability, right? And at the end, though, where we see the issues and the relapses, once that accountability goes away, and so how do we keep them engaged in that? And that's where those community-based 12-step groups and other supports like that are so vital, is making sure they've really made those relationships. One of the coolest things that ever happened, when I started here in Idaho doing this work a lot, I would talk with judges and people, and they'd say, 12-step meetings just don't work. And so I'm like, well, they do, but that's the excuse, right? When I'm in active addiction, 12-step group is not the place I want to go. And I'm going to tell you everybody's selling drugs in the parking lot. I'm going to make up all these stories because I don't want you to send me there because it's like way too scary. And what happened was now we've seen judges start to call AA, NA, all these 12-step group hotlines to say, I want this guy has to get a sponsor to get out of jail. And it's just such a cool process to see people sort of wake up to that and see that, okay, this is what they need. They need that community around them. And they need connection. And that's really what it's about, is being connected with people who truly understand us.
Thank you.
Yeah. Any other questions?
I'm just curious, since you've been doing it for so long, and you talked about the hereditary part, are there families that you've ran into where it's just been handed down? So your daughter, for instance, you were, clean and sober, but where you ran into, 3 generations?
Oh, yeah.
And so then at that point, that family support is, the family is really probably supporting the habit versus supporting a clean and sober.
Absolutely.
Okay.
Yeah.
Wow.
See it all the time. Generational alcoholism, trauma, everything gets handed down. And there are plenty of people I know that are the first to get out. Everyone around them died, from this disease. And it's so apparent, the alcoholism and addiction. So, yeah, see it all the time. All right. I think that's my time. Any other questions before I? Okay. Thank you for having me.
Lots to think about and great insights. Thank you so much, Ben, for accepting our invitation to come and speak and sharing your personal path intertwined with your professional expertise. I think you've earned it and worked hard for it, and respect that process. And it's always good to open our minds to that and hear another person's experience. I also appreciate and grateful for the things that you said that we can each do. That's why we kind of come together, and then hopefully when we go back out into the community, into our everyday life, and the people that we surround ourselves with, we can then take this with us and do better. So thank you very much. I'd like to thank everyone that joined us this morning, the elected officials, Councilman Kavner, the chief. I'd also like to thank LaPeep. They have been supportive. They can never stay because they're serving breakfast elsewhere. But they've been great supporters, along with Human Being, to make this a breakfast event, because start your busy day. And then the recovery partners that we have, there's many of them, but specifically North Point and Southworth Associates for being here. And to all the dedicated volunteers that always chip in and accept the tasks that I so graciously appreciate and that they do so eagerly. So again, teamwork, and for everybody being here today. I hope that you'll take away and take some time to reflect on what we heard and how we can then apply that in our lives, like I said. And I do agree that there's lots of progress being made, and more understanding about the disease of addiction, and more understanding about when stigma is present and how we can do better in that area. I did want to jump on a topic that I'm extremely passionate about after a decade of working in this position, and following marijuana policy across the country and the changes that we've seen. Ben hit on the increased amount of psychosis that we're seeing. And while that's not all 100% preventative, a large part of it is, and we're still in a very unique position in the state of Idaho, not having had any policy change related to marijuana, hemp, whatever you want to call it, cannabis. And so I encourage you to, there's a documentary that was created for the state of Idaho, because we've been one of those states that's held on for so long, and it's called Smokescreen. There's a flyer on the back table about it, but I'd encourage you to watch it regardless of what your stance is. I just think it has good points, and it's a good conversation piece to have, and encourage you to talk to your elected officials and let them know how you feel about that